The objective of implementing this change project is to reduce the amount of hospital-acquired pressure ulcers that patients develop on our unit. The reduction of these preventable injuries will afford patients higher quality of care, higher quality of life, shorter hospital stays, fewer long-term complications, along with saving the hospital system a great deal of unreimbursed costs associated with hospital-acquired pressure ulcers. This change project is a quality control program for our unit. According to Marquis and Houston, in order for a quality control program to be effective, it must cover 4 components. The program needs support from top-level administrators. It must be made a commitment by the facility in terms of using fiscal and human resource support for implementation. The quality goals must strive for excellence rather than simply state or federal regulatory levels, and the process must be continuous and always striving to provide higher quality care. In this aspect, the continuous strive for excellence is where the assessment and evaluation of the change project come into play. First, I have an assessment tool that the change project team would use as a concurrent or retrospective audit. Auditing is an official examination of a record or account to evaluate performance. Concurrent audits are performed while the patient is receiving the service, while retrospective audits occur after the patient has received the service. The audits would be done once a week by the research committee on a random selection of patients who are on our unit that week, whether they were admitted directly to the unit or transferred there from another unit. This weekly audit would look to see if the 2-nurse skin assessment was documented as completed upon arrival to the unit. It also checks if a wound group documentation was added to the patient's chart on admission, and if there is a progress note documenting that wound team was notified if any alteration in skin integrity was found. As shown in this example audit, the research committee would easily be able to follow how often the 2-nurse assessment is and is not documented by the nurse receiving the patient upon arrival. They can also clearly show if a wound was found upon admission or arrival to the unit, and if the wound care team was subsequently involved to assist in providing care to the patient. The importance of this assessment tool is to continue to improve the adherence to the new policies and procedures put in place with the change project. It can be used to find how often the skin assessment is not being documented, and the leader or manager can then use this information to find out why, or if there are better ways to remind the nurses to document this on every patient. This assessment tool is also important in that it can give a clear picture to if a pressure injury was found prior to admission to a unit, which is noted if a wound group is documented upon arrival. This documentation would prove that if a patient had a pressure injury prior to admission and is found on admission, the injury could not be classified as a hospital-acquired injury, and therefore the facility would still receive payment for the patient's stay. Lastly, this audit assessment tool would give the leader or manager insight as to how often the unit's nurses are contacting the wound care team for further assessment and wound care recommendations, so that they could continue to encourage the use of the valuable insight that the wound care team can provide. The second assessment tool that I have proposed is an outcome audit. Outcome audits determine what results occurred as a result of specific nursing interventions for patients. These audits assume that the outcome accurately demonstrates the quality of care that was provided to the patient, and many experts consider outcome measures to be the most valid indicators of quality care. This assessment would give our unit's percentage rate of pressure ulcers. We would use the National Database of Nursing Quality Indicators, or NDNQI, monthly reports that are sent to the unit's operations manager. With that information, we would find the number of pressure ulcers applied to the unit per patient days, which would then be used to find the percentage of patients on our unit who developed pressure ulcers. The importance of this tool is that we will be able to clearly see if the change project changes our pressure ulcer rates, as we would compare data from the 6 months prior to implementation to the 6 months post-implementation. In this example, I have real data from my unit from a prior year inputted into the assessment tool to show what it would look like. Adding up the rate per 100 for the 6 months, we get an incidence of 1.2%. So 1.2% of the patients on our unit for those 6 months developed a pressure ulcer. Using this tool, we could find by how much we decreased the pressure ulcer rate on the unit through our change project. In addition to these assessment tools, we have a measurement criteria to measure the success of the change project aside from the hard data in numbers pre- and post-implementation. These measurements focus more on the nursing procedures and can be audited by the change project team just by looking in current patients' charts to check documentation. Number 1, a 2-nurse skin assessment is completed upon admission or transfer to the unit. Number 2, if a patient has a Braden score of 18 or less, or a nurse identifies existing or potential areas of concern, the following nurse implementations are documented and completed. Q2 hour Turner repositioning, skin barriers applied, documentation of wound consult by nursing or nursing notified provider to order wound consult, and documentation that the nurse notified the provider of an existing or potential area of concern. If a pressure wound is present, are wound measurements documented on discovery and every Monday unless there is a provider order for dressings to remain intact? And if wounds are present, is there a provider order for treatment in the electronic medical record? With the audit of the nursing documentation and using this measurement criteria, the change project team and the unit manager can continue to encourage proper documentation and can see in real time if our data results will be accurate because we will know if the policy and procedures were adhered to closely.